Welcome to Doctor's House Call. This is your chance to get in gear with Dr. Gear, a duly trained naturopathic medicine doctor and doctor of chiropractic, board certified in family medicine and minor surgery. Brought to you by Payson Health and Wellness Center at 801 East Highway 260 every Tuesday afternoon from 5 to 6, live on KMOG. You can call in now and speak to the doctor at 474-2427 with any questions, or after the show, call Dr. Gear during regular office hours, 474-7409.
Well, good evening. Mike Ferrell here with you, and good evening to Dr. Weyrich.
Good evening.
And can you give us a little update on Dr. Gear's condition?
Yes. He celebrated his 80th birthday on Sunday. I was in attendance and met with him, and a number of patients went to see him, and Dr. Ergy was there, and his family was there, and it was a very upbeat time. And he's lost some weight, but he's looking really svelte and looks really good.
Good. Well, that's good news. Maybe we'll hear from him tonight on the phone.
There's a possibility.
All right. Tonight you have several different subjects you're going to be covering, and we want to invite you, any of these, if they strike a note with you that you have a question about it, anything that Dr. Weyrich says, or perhaps some symptoms that may lead to what we're talking about, please just give us a call at 928-474-2427.
And especially I will be signaling when I'm going to wrap up each of the 4 segments that I have planned for this evening.
Okay.
And as I'm wrapping up segment, that would be an excellent time to call to talk about that segment, or anything previously that we've talked about on the air, or anything else that's on your mind. I'll be reminding you when it's when a good time to call is.
All right. Tonight's topics: what's new in medicine, also the pill for COVID, and you're going to talk about Naturopathic Pearls, the safe use of cortisol.
So let's go into the first segment here. I'm going to be talking about a new drug called Molnupiravir, and it is a pill for COVID. Today is a very good day to talk about it, because today is the day that the FDA is taking up the discussion of whether to approve it or not. It has already been approved in the United Kingdom. It was originally developed to treat the flu, influenza, and it's also been found to be effective against Ebola and a number of other coronaviruses. And coronaviruses in general, when I was in medical school, they were said, well, a lot of the common cold symptoms come from coronavirus, among other viruses. So COVID's been around for a long time, and what we're dealing with now is mutated in some way, but it's just a coronavirus, and we've got at least one oral drug that there's good evidence is useful in treating coronavirus now.
Is that for after you get it, though? Not to prevent it? I mean, the vaccine prevents it, right?
Right. So the current usage is for mild to moderate cases when you're diagnosed, with the goal of preventing hospitalization. I will talk a little bit later about the idea of taking it just to prevent, and I don't recommend that personally, and there's some other people that don't like that idea either. But I'll go into that in a little bit.
Okay.
But that's a good question. Okay, so it was originally developed at Emory University, which is in Atlanta, Georgia, in 2018, and it's now being distributed by Merck. And it is a similar drug to AZT. AZT hit the news big time because it was the first drug that was available to treat AIDS. And it works in a similar way. AIDS is a special kind of RNA virus. Coronavirus is an RNA virus. And that means that the genetic material is ribonucleic acid instead of DNA, which is what we have in our cells. But it works pretty much the same way. We have both DNA and RNA in our cells, but the virus only has the RNA. And the RNA has the genetic information that controls how to make viral proteins. And so in order for the virus to reproduce in our cells, it has to make copies of its RNA. So this drug interferes with making copies of the RNA. A little bit of background information. RNA is constructed of a long chain of 4 different substances, which are called adenine, cytidine, guanidine, and uridine, or A, C, G, and U, respectively. And there's a genetic code that is universal for all life and for viruses on the planet. Those 4 letters code for all the 20 amino acids that are found in proteins that are coded for by our DNA and our RNA and viral DNA, viral RNA, and all other forms of life, including bacteria. So it's very universal that this same code is used. But main point is each word is 3 letters long that specifies 1 amino acid to be put into a protein. And if you change the letters, you get different amino acids. And when that happens, we call that a mutation. So any mistake in copying the RNA from the original virus to the copy viruses that are going to be released to spread the virus, any mistake is in effect a mutation.
Well, is that good or bad?
Mutations?
Yeah.
Well, yes, and I'll get into that.
Okay.
So if you get one mutation, usually the virus will die or won't succeed in reproducing. But every once in a while, you get a mutation that can reproduce, and it produces a new variant of whatever the original virus was. So mutations that kill the RNA line so that it doesn't function anymore, those are good for us, and that's what we want when we use a drug to treat the RNA virus. We want to throw sand into the gears, if you will, so that it can't reproduce. But occasionally, we might get a mutation that survives and reproduces, and that creates potentially a new variant of the virus, which is not good for us.
Like the new variant that's out now?
Right.
Omicron?
There's a number of different variants. They started, I guess, with Alpha and Beta and Delta. They skipped Nu and C for some reason and went to Omicron, but they're about halfway through the Greek alphabet at this point.
Well, we can stop right there as far as I'm concerned.
But this is one of the concerns with using a drug like this. It may, especially if misused, cause increased production of new variants, which is not a good thing for public health.
Yeah, of course not.
But if it's used properly, then the hope is that the mutations will be so severe, multiple mutations in each RNA strand, that there's no way that it can reproduce and be viable. And so that's the goal. And as I said, this is the same class of drugs that as AZT, which was the first drug to use to treat HIV/AIDS. And there's a number of other similar drugs that all have generic names that end with vir, that treat various different viruses. Acyclovir is used to treat herpes virus, and so on. So there's a lot of drugs like this out there.
I have a question, if it's all right. When we talk about mutations, I think of a variant.
Yes, exactly.
And isn't that the same thing that happens every year with the flu? Don't we have several variants of the flu? That's why they have to try to come up with a shot that covers all that?
Yes. The flu is very, very different, though, than the coronavirus. The flu has more than one piece of genetic material in it, and it's sort of a mix or match. And the worst case scenario is a person or an animal, like a pig or a fowl, gets 2 different viruses, flu viruses at the same time, and they mix and match, and a dramatically different flu virus is produced. And so the structure of the genetic material in the flu makes it very, very unstable and very, very likely to mutate every year. Whereas the coronavirus, we don't expect it to mutate nearly as rapidly.
Okay, and the other thing that I wonder about is this year they're talking, of course, about people getting vaccinated for the COVID and getting their booster shots, but what about the regular old flu shot?
Well, that's still being recommended, and it's been pointed out that You don't want to get the flu and COVID at the same time. That would be a disaster. So the argument is that you really ought to get your flu shot.
So that does happen? You get both at the same
Theoretically,
time?
it's possible.
Oh.
I don't know how often that happens. It's not in the statistics that I see being reported. But
aren't the symptoms pretty much the same, though?
Well, they're both
just more severe.
They're
perhaps?
both respiratory viruses, and they're attacking the same part of the body. And so the two combined would be double whammy. So, again, I'm not pro-vax, I'm not anti-vax. I think that every person should make an informed decision on their own. And my goal is to give you the information that I know and the thought processes that I have so that you can make the most informed decision that you can.
Isn't the scientific evidence pretty much in favor of getting the vaccination? The studies that have been done? The science.
Are you talking about the flu or the COVID?
The COVID vaccine.
There's information that I would like to have that I've not found. For example, you just had in the news all this statistical data about how many people of each age were new cases of COVID this past period of time. But what I haven't heard is how many of the new cases of COVID previously had COVID and recovered, how many new cases of COVID previously were vaccinated but got it again anyway, and how many of the cases are...
Those records are out there. They call those breakthrough. Okay. They're now at about 22%.
Okay, so 22% failure rate of the vaccination.
Right.
Okay, what's the breakthrough rate on people that have recovered from natural cases?
I've never seen a statistic on that.
I haven't either.
They haven't been able to or figure out how to keep track of that.
I'm sure that they know. They know who's already been diagnosed in the past. And if they are choosing not to report it. And I can't imagine that they don't know.
Well, just looking at the State of Arizona report, the latest one,
yes,
they have in there the fact that there have been constantly more and more breakthrough cases.
Right.
And that's because of the fact that most people who needed to get vaccinated because of medical complications and age and that type of thing, it's been 6-7 months ago, and they never knew how long this vaccine would be effective, and now they're thinking that that's especially why everybody over 18 should get a booster shot.
Well, and there's also the question, are these the original COVID that are breaking through, or are these variants?
Yeah, well, mostly it's, I think right now, the Delta variant.
And it's questionable how well the original vaccine protects against the variants.
But here's
and that's
the
real concern.
Thing. The death rate in breakthrough cases is less than 0.1%.
Okay.
I mean, extremely low.
Okay. So even though you're getting it again, the vaccine seems to be protective.
Correct. It seems to keep hospitalizations down and deaths.
Yes.
Both,
Yes, which is a good thing. And last statistics I saw, Florida which was criticized for being relatively open about COVID and so forth. Florida has now the lowest rate of new cases being diagnosed, which suggests that Florida has achieved herd immunity. And was the original goal for the entire world, was that we will develop herd immunity. And so...
in one way or another, either with vaccinations or with people getting
the natural
the COVID immunity, and then having the antibodies.
Right.
Interesting. I didn't know that about Florida because they've been so up and down. Sometimes they're the worst in the nation, but right now they're not.
Right.
Is that what you're saying?
Yes. The latest news that I have.
Okay.
Let me say that this new vaccination, or this new oral drug, various reports show that it is 90% to 30% effective in preventing hospitalization and death. So the most recent data that has been released by Merck, the manufacturer, is that it's 30% effective. Previous reports were that it was much more effective than the current reports.
Okay, one of the things I wanted to ask you about, too, with that pill that they're saying is the have them in too much record keeping on that yet because not enough time has gone by.
Right, there have been some research trials.
Right, a few trials, but they are really seem to be not quite sure how effective it is.
Well, like I said, the most recent studies that have been published by Merck are that it's 30% effective, but you always have to take that with a grain of salt unless you know exactly what the study population was and exactly how they're measuring effectiveness. So there are those variations that if I read the original reports, I could probably report on, but I don't know that information.
Okay, now that particular pill, correct me if I'm wrong, what I have read is that it's a 1-week treatment, 2 pills a day.
It's 800 milligrams is recommended a day, and the test results that I have the study report on was that after 5 days, the viral load was reduced to 0.
Wow, that's pretty good.
Yes, so that's an average, so it doesn't mean that everybody, but it is statistically significant, and I would say that it is clinical.
And how many days was that?
5 days, yes.
I think that's basically what you take it, 5 or 7 days.
Yeah.
And I think the cost is somewhere between $500 and $700.
Well, that's an interesting question because Merck has agreed that for 105 of the poorer countries in the world, they will not collect any royalties and allow it to be treated as a generic drug. Whereas in the United States, they want to get their pound of flesh, my words, from the users and collect royalties.
Didn't the government sign a contract with them for $1 billion some dollars?
Well, perhaps. I think I saw reports like that, but that doesn't address what the government agreed to pay for each pill. But it appears that Americans, or America in general, is going to be paying a lot more per pill than in other parts of the world.
Okay. What I read about that was that normally the treatment would cost $700, but with the arrangement that the United States government made, it'll cost $500.
Okay.
And they'll pay it. In other words, it won't cost
the taxpayer.
You or I anything.
Yeah, no, the taxpayers.
As taxpayers, correct.
Yes, but other parts of the world, the government won't have to subsidize as much.
Right.
So there have been concerns, though, that if it is used as a prevention and everybody's taking it, especially if they're taking a lower dose, that there can be a problem with drug resistance developing. You know that many...
Like antibodies.
Yeah. Well, it's not that. The virus mutates to avoid so that it can ignore the drug. HIV/AIDS drugs have notorious problems with that. They lose their effectiveness after a while. And so as a result, AIDS patients are given 3 or 4 different drugs all at the same time to hit the virus from many different angles to reduce the possibility that it can mutate. And that extends the useful life of the drugs.
So if this is not really effective to keep from getting COVID, then what can you do if you're not going to get vaccinated to keep from getting COVID? Get your immune system boosted?
Absolutely, and I've been a big proponent on this show of vitamin D3 and vitamin K2 as being essential for balancing and strengthening your immune system.
Okay.
And, of course, avoidance is always good. It's questionable how much benefit there is from the cloth masks as opposed to an N95, but there's some benefit.
There's a lot of things that affect the immune system, correct?
Yes, absolutely.
Lack of sleep, for example, can weaken your immune system.
And it's not widely known, but binging out on sugar suppresses your immune system for several hours.
There you go. So what else should people really watch out for? Too much alcohol? What can really hurt your immune system?
Well, too much alcohol is on the list. Any foods that you have IgG reactivity to would be a bad idea because that stirs up the immune system and directs it in a certain way. So that's the main thing. And there are some herbs and particularly some mushrooms that are reputed to balance or promote some certain immune response. But the COVID virus appears to go through different phases where different aspects of the immune system are called up, and so it's hard to say this is the one thing that you should take.
Okay.
Other than the vitamin D, which seems to help the immune system respond to whatever it needs to respond to.
Vitamin D seems to be the new superhero
Yes.
on the block.
Yes.
For everything.
Yes.
That you get naturally through sunshine.
Sunshine, or you can buy it in the store.
Right. But also, what about vitamin C? We've always heard that vitamin C is so important for your immune system.
Yes, but let me say that just about everything that is considered part of a good diet is beneficial to the immune system. Minerals like iron and zinc are useful in the proper amounts. There's all kinds of herbs. Protein is necessary to make the immune response. So a good healthy diet and good sleep are the best natural preventatives I can recommend.
What about exercise?
Moderate.
Okay.
If you exercise too much, you will stress the
Wear
system.
yourself down, right?
Yeah.
All right, this is probably one of the biggest topics of our time. This whole variant thing and COVID and the whole situation.
Okay, so our next topic is the safe use of cortisol. And we ended the last topic with a lead-in to this topic. We were talking about how exercise, if too much exercise, can deplete the body and disrupt the immune system. And one of the things that overtraining or too much exercise does is it depletes the adrenal system, which produces cortisol. Cortisol is a stress response hormone, among other things. And so cortisol is naturally made by our adrenal gland. And it normally is higher in the morning, lowest at night.
But it's bad stuff, right?
No.
Oh, I thought it raises your blood pressure.
Well, there's this about just about everything in life. There's a happy balance point in between two extremes. Either extreme is bad. So cortisol is necessary, and if your body loses its ability to make cortisol due to some injury or some other cause, you are in danger of dying, and it's a medical crisis. So cortisol is necessary. It helps regulate blood sugar, and it's part of the stress response. But if you're constantly, as I say, burning the candle at both ends, going through a lot of cortisol and maintaining that crisis state for long periods of time, it's going to wear your body down. It's not good. So
Okay, so you get stressed, you're in the crisis state, your body produces extra cortisol.
correct. Until at some point your body collapses. So Hans Selye was a Canadian researcher, I believe, who studied the stress response and cortisol with rats. And he would do things like take a bunch of rats and throw them into a tub of ice water, and they'd have to swim. And at various times he would pull a rat out and measure their cortisol level. And he observed that when the rats first were thrown into this stressful situation, their cortisol went way up, and then it maintained for a while, and then it started going down. And about the time that the rats became exhausted and succumbed to drowning, their cortisol was very low.
Is that like adrenaline? Isn't that the same
No.
type of reaction?
Well-
Adrenaline when you get stressed or when you're threatened?
Okay, the adrenal glands make a number of different hormones, and there are two main parts of the adrenal gland. One is called the cortex, which means bark. It's the outer layer of the adrenal gland.
Where are they located?
Adrenal glands are about the size of a walnut, and they sit on top of your kidneys.
Okay.
But they have an outer bark that produces a number of different steroid hormones. Cortisol is one. Aldosterol helps regulate blood pressure. Estrogen, progesterone, testosterone, to some extent, are all produced in the adrenal glands. But then the inner part of the adrenal gland, the medulla, very different tissue that came from a different part of the embryo as it was developing, and it makes epinephrine or adrenaline and other similar amine hormones. So two different parts of the adrenal gland, two different kinds of hormones. But yes, the cortisol is part of a stress response. The epinephrine is part of, or adrenaline is part of a stress response.
All right.
Let me say just a little bit more about cortisol. People with autoimmune diseases often have low cortisol. People with a lot of allergy symptoms often have low cortisol. Cortisol can be used to treat all kinds of inflammation. A synthetic form of cortisol that's much stronger than the cortisol that our adrenal gland makes is called prednisone. And you've heard of many people that take prednisone.
It's a steroid, isn't it?
It's a steroid hormone, so is cortisol. But prednisone is a synthetic hormone that's much stronger than cortisol. But too much prednisone causes the body's ability to make cortisol to shut down. So if
Wow, that's really interesting, because when I've had a really bad allergy attack, or breakout of hives and all that kind of thing, they've put me on the progressive.
Yeah, they hit it strong,
right,
and then they taper it slowly.
8 pills, and then 6 pills, and then 4 pills, and 2 pills.
Yeah, because if you went cold turkey off of it at a high dose, your adrenal system would collapse, and you'd be in the emergency room.
But it's not really good for you, correct?
Well, depends on what ails you. I'm not going to speak ill of any drug, really, to the point that I'd say it's never of use.
It's so confusing. The body is so complex. I know of several people who've kind of dabbled in supplements, and when we talk about iron and zinc and that kind of thing, if you get too much, you can have even more problems than you ever thought of.
Oh, yes.
Right?
There's a rare genetic disease that causes iron to accumulate in the body, and it rises to toxic levels and is one of the causes of liver failure.
I had heard that, especially in men. Too much iron.
Yes,
Right?
I think that, women, at least until menopause, don't usually have a problem with iron overload because they regularly bleed.
Right.
But
shouldn't most people just get their iron from food?
Yes. I usually tell patients, if you are a man or a postmenopausal woman, if you have low iron and think you need to take a supplement, stop. You probably have an internal bleed of some kind that we need to identify and fix.
Internal bleed?
Yes.
That sounds serious.
It is. I'm thinking of one patient of mine and Dr. Gear's that was really tired and dragging, and she came to me and wanted me to prescribe hormone replacement for her, thought that would help. And I said, wait a minute, your blood tests show that you're very anemic, and the only way that you would be anemic like that is either if you're on a starvation diet or you're having a bleed. Many doctors tried for about 6 months to find the cause of the bleed, and they finally found it. It was a hiatal hernia that was bleeding into her stomach, and they did a surgery, and her iron levels are coming back up to normal. So if you have a low iron, and we don't expect you to have a low iron, then we need to do some detective work.
Okay. Is it, when you say an internal bleed, this is the first time I've heard about that. That's not like a leaky gut syndrome,
No.
right? No.
Okay. So your most internal bleeds are some part of your GI system. If you get a stomach ulcer, it will bleed into the stomach, and you'll have a black tarry stool. If you get a small intestine or a colon, a large intestine bleed, it'll bleed into the colon, and you'll get a black tarry stool. If you have a rectal bleed called a hemorrhoid, you'll have bright red blood in your stool. But they're all forms of internal bleeds that cause a loss of blood, and you don't always know that you're bleeding. This particular patient didn't know that she was bleeding, didn't have any symptoms other than she was just tired.
The symptom of fatigue is so I mean, so many people have that, and there's so many different causes, like thyroid.
Yes.
I mean, you doctors, I just don't know. When someone comes into you and they tell you, look, I'm not feeling good. I'm, whatever. How do you know where to start?
Well, it's called a differential diagnosis, and we basically list all the possible causes of the symptoms, and then we try to prioritize them as what is most likely or most dangerous, and we do tests for the most likely causes and for the most dangerous causes first, and we just work down the list until bingo, we find lab tests and physical exam tests and so forth that give us a diagnosis that matches the symptoms.
I know in some cases you do urine tests, in some cases you do blood tests,
yes.
In some cases do you do hair tests?
Dr. Gear is very fond of the hair test for heavy metals. I prefer the urine test, but there's also saliva that can be tested depending on what we're looking for.
Okay. Once again, heavy metals, what are your symptoms going to be if you got too much of that?
Lead poisoning can produce high blood pressure. Also can cause abdominal cramps. Mercury tends to be associated with poor thyroid function. Mercury toxicity attacks the thyroid.
Mercury, we got to worry about fish, right?
Well, yes and no. It depends on your genetics to some extent, and it depends on the kind of fish. There is another nutrient called selenium that helps antidote mercury. Different fish have different ratios of selenium to mercury. So if you have a fish with a typical amount of mercury but a lot of selenium, that's a good fish to eat because the mercury will be well antidoted by the selenium. Mm-hmm. And there's other fish that are relatively low in selenium, high in mercury.
So the lead that you would get is what, from the gas in the air?
Not so much anymore. Back when I was growing up in the 70s, they had lead in the gasoline.
Right. Yeah, that's true, and they've taken care of that pretty much. So where could somebody be getting lead? In their water?
A lot of kids living in old houses, the white paint used to have lead in it. It was the white pigment. Okay. It was a lead oxide.
What about pipes?
In Michigan, I can't think of the city right now, but there's a city in Michigan that had terribly high lead levels.
Flint, I think
Flint, yes, that's it.
Yeah, and that was because of old pipes.
Yes.
Had lead.
Yes. Right. So just as an aside, the word plumber, person who worked with pipes, comes from the Latin word for lead, plumbus. So the original piping, and some people, commentators, say that part of the reason why the city of Rome fell was because they had lead piping and it caused insanity.
Aqueducts. And they had, all of that, didn't they?
Yeah.
Wow. Interesting. So we got lead to worry about, mercury to worry about. What else?
Cadmium and arsenic are the other ones that are most of environmental concern.
Isn't arsenic in our water supply?
I'm sure it is. But here's the thing. We have the ability to measure very, 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 very small trace amounts. And so there's a question about how much is safe and how much is too much. And
it's all in the potion?
Yeah. The dose is in, or the poison is in the dose. We've talked about that
Somebody
before.
said that one of the great philosophers, Plato or something.
Yeah, it was actually an Austrian alchemist. His actual name, Bombastus von Hohenheim.
Wow, that's a mouthful.
Yeah, and he also went by the name Paracelsus, but he said all things are poison. There's nothing that is not without poison. Well, it's only the dose that makes the difference.
That's interesting because I know that when I've seen the water sample supplies here in any town I've ever left in, there's always a trace of arsenic, a certain amount of arsenic in the water. And I've asked about that, and they say, oh, yeah, well, it's a poison, but not in small amounts. It actually, won't hurt anybody in the amount that's in the water, and it needs to be there, and it's there naturally.
Yeah, it's there naturally in most cases, but there is actually some research, not very much, that suggests that maybe arsenic is a necessary nutrient in tiny amounts. We used to think that selenium was a toxin until we did further studies and found that selenium in very small amounts is a necessary nutrient. It's a very important antioxidant. So science is learning more all the time. And part of my next segment, we're going to talk about how science is never really settled. There's always more to learn. And sometimes we have to revise our theories.
Makes sense.
But I believe we have a caller coming in.
Go ahead, caller. You're on.
What about high platelets, like 1.7 million high platelets?
Okay, platelets is a totally different issue from cortisol. Platelets are part of the clotting mechanism, and if you have really high platelets, you're probably at risk of blood clots and strokes.
I've had them for years, and now they're saying that I need to be put on hospice, and I feel fine.
That I wouldn't go that far. If you feel fine, then platelets, until you stroke out, you're not going to notice a whole lot of symptoms, I don't think. So if you feel fine, what you really need to be doing is finding a doctor that can deal with high platelets, and there are drugs that will reduce the risk of having high platelets. That's not something that I'm trained in, but I'm sure that there are hematologists that are trained in dealing with high platelets.
I go to an oncologist, hematologist, but they want me to take this hydroxyurea, and I've taken it before, and it gives me blisters in my mouth, and it makes me feel loopy, like I'm not, coherent.
Okay, you might want to get a second opinion on that from another hematologist.
Okay. Just thought I'd ask.
Okay, well, thank you for calling.
Uh-huh.
Interesting. That I've never heard about either, So,
well, when you're told to take a baby aspirin, what that does is it suppresses the coagulability of the platelets. So that's how taking a baby aspirin helps.
So when she has high platelets, that means the blood is not at the right...
It means she's making too many platelets for some reason. And there are different ways to deal with that. One way is certainly she should be on baby aspirin or maybe more aspirin since she has a lot. But again, this is not my expertise, but there are a number of drugs that generally deal with blood that has too much of a tendency to clot. And there are natural things that benefit reducing clotability. But fish oil and vitamin E come to mind as things that can reduce blood clotting. And surgeons don't like patients to be taking fish oil or vitamin E before they go in for surgery because they're more at a risk of actually having an unstoppable bleed.
Same way with garlic.
Yes. So there are lots of natural and pharmaceutical approaches to reducing the activity of platelets, but I don't have specific information on cases where there's clinically seriously elevated platelets. But
that you bring up a good point, though. In my experience, any kind of drug you take to solve one of these problems causes you other problems. It seems like there's always, for every action, there's a reaction. There's side effects. And if you can do it naturally, for example, if she could be taking, a garlic, maybe not supplements, but, working that into her diet more. And what was the other thing?
Fish oil, vitamin E.
Okay. But once again, all these things should be done under a physician's guidance, because if you get too much fish oil, it can cause some other problems.
Right. And so my approach to a patient like that would be, first, let's see your history, but let's get a measurement of what your platelet count is. And so when we do a treatment, especially a natural treatment, we have to look to see what the actual response is, because there's not a lot of science saying we know how to treat high platelets with fish oil. From a theoretical point of view, I know that it can be beneficial, but I can't say what the dose is for a particular platelet count or anything.
The Mayo Clinic newsletter, a letter here on the back for what they call second opinion.
Yes.
My doctor suggested that I start taking fish oil to lower my triglycerides rather. What do I need to know before I start? And he says, fish oil provides the omega-3 fatty acids, DHA and EPA, which your body can't produce on its own. There's strong evidence that these unsaturated fats can significantly reduce your triglyceride levels up to 30%, according to some studies.
Yes.
And then they go on to say later on, before starting any supplement, speak with your healthcare provider. The Food and Drug Administration advises most people not to exceed 3 grams a day of EPA and DHA combined. A higher dose of fish oil can interfere with certain drugs, such as those taken to prevent blood clotting, to lower blood pressure, and to promote weight loss. If you're undergoing a procedure soon, discuss with your doctor the need to stop taking fish oil beforehand, because it can increase your bleeding risk, just what you said.
Yes.
When generally considered safe, fish oil supplements do have some possible drawbacks. They can cause mild side effects such as a fishy aftertaste after a burp. That's
a real
for
problem.
sure. Bad breath, heartburn, nausea, diarrhea, a rash. And they go on to say exercising is another way to lower triglycerides, as muscles in the body use triglycerides as an energy source,
Yes.
cutting down on refined carbs such as white bread, white rice, and white pasta, as well as sugar and sugar-sweetened beverages, and alcohol also can help.
Yes.
And not alcohol can help, but cutting down on sugar and alcohol.
Yes.
And alcohol is sugar, right? It ends up in your body being sugar. Somebody told me that. One physician one time.
Alcohol metabolizes to acetaldehyde, which can be recycled into making carbs, or it can be recycled into making fats or some proteins.
Okay, I remember now it was a physician that was talking about blood sugar, and he was saying that, if you drink alcohol, expect your blood sugar to go up, because it eventually is, you're just putting sugar in your body.
Well,
So
alcohol
that's where
is
I got
not
that.
alcohol is, strictly speaking, not a sugar.
Okay.
But sugars are alcohols. And I make the distinction because the common table sugar, or glucose, let's say, has, I think, about 4 or 5 alcohol groups on each molecule, whereas drinking alcohol has 1 alcohol group per molecule. So sugars are super alcohols so far as the chemistry is concerned. So
didn't mean to get you off the thing,
that's
but
okay.
So many people do take fish oil.
Yes.
And as a supplement, and I just thought it is really hard, especially living here in Payson, to get fresh fish. I mean, and to have fish as part of your diet,
well, canned
you got to
tuna
work pretty hard.
Canned tuna is pretty good.
Yeah, that's what I do.
And if you go to Costco, you can get very high quality tuna that is tested, and they report that how much mercury is in it, and it's below a very...
Right. I know tuna is pretty good. Swordfish is supposedly one of the highest in mercury.
Yeah, swordfish is very bad. And in general, you want to eat smaller fish.
That's what they make the best omega-3 out of, I believe, is sardines and stuff like that.
Well, actually, they're making, quote, fish oil out of things like calamari now. And algae actually can make the DHA and so forth. So if you're vegan, then the algae source of the essential omega-3s is the way to go. In general, big fish have more mercury in them because of what's called bioaccumulation. Little fish pick up a little bit of mercury, but then the bigger fish eat the little fish and they get all the mercury that was in the little fish, and then bigger fish eat the medium-sized fish, and up the food chain, the higher on the food chain you go, the more mercury and other toxins tends to accumulate.
Those kind of heavy metals that we've been talking about, a lot of people don't even know what's wrong with them when they're having a problem with that.
Yes.
That's what's so sad about the whole thing, is that it takes forever to discover possibly that, you've got too much mercury.
Especially if you go to a doctor that's not familiar with environmental medicine. Now, part of my naturopathic training was I specifically studied environmental medicine.
Correct.
And so I'm more up on environmental medicine than many of my MD colleagues who perhaps have never had a course in environmental medicine.
Mm-hmm. Okay, well, that's really important, because I always thought mercury and lead mainly affected children.
Well, children are very susceptible, but you've heard of the Mad Hatter, haven't you?
Mm-hmm, yeah.
Why was the Mad Hatter mad?
It was because it had something to do with a chemical they were using to clean the hats, wasn't that it?
The felting agent contained mercury. So the symptoms of being a Mad Hatter are mercury toxicity symptoms. And while we're talking about mercury, down in Paradise Valley area and part of Phoenix, there's an area called the Dreamy Draw.
Oh, yeah. We've all heard of that.
Yeah, and that is an old mercury mine, or it's the exit to an old mercury mine. And the story is that the mercury miners, at the end of their shift, were kind of spaced out and dreamy as they walked home down the...
Really?
That's the story.
That's interesting. Never knew that. Gosh,
Yep.
I learned a lot tonight, Doctor. You're just a wealth of information here. You really are. And another thing in the letter there that it says is that, and something I wasn't even familiar with, atrial fibrillation. Am I saying that right?
Atrial fibrillation. That means
can be caused by even one drink,
among other things. So atrial fibrillation is a condition where the heart doesn't beat regularly, but beats fast and irregularly. And it's of main concern is that under those conditions, you're more likely to form a clot in your heart that can go into your brain and cause a stroke.
Heart attack, right?
Yes. So that's why Afib, as it's usually called, is a problem. So what promotes Afib? Anything that raises sympathetic tone in the body tends to promote Afib if you're susceptible. Any thing that suppresses sympathetic response will reduce Afib until it wears off. So you're not likely to get Afib while you're drinking alcohol, but when you stop the alcohol suddenly, the Afib is one of the possible side effects of stopping the alcohol as the body rebounds.
Oh, okay.
And so that's generally true of any sedative drug or blood pressure medicine. If you suddenly stop it.
How is that treated? Is that what they
Afib?
use a pacemaker for?
To treat Afib, pacemaker can be used, but often what they do, there are drugs that can help Afib, and then they'll also put you on what's called a blood thinner. Warfarin is the traditional one. There's newer ones like Xarelto.
Interesting thing about warfarin, that was a rat poison.
Yes, it was a rat poison before it was a medicine.
That's really crazy.
But before that, it was just a nuisance that caused cows to die mysteriously.
Mm-hmm.
And it came originally from the cows grazing on moldy clover, I believe.
Yeah, or grass, when certain kinds of grass.
Yeah.
Fescue.
Yeah, but it was not properly dried. It developed the mold that made the warfarin.
Right.
And so...
Isn't that interesting? But they found a way to actually use it.
Well,
again, we're talking about doses, aren't we?
Yes, absolutely.
So interesting. Yeah. Everything in moderation.
Yes. Yes.
Okay. All right, we have a caller. Go ahead, caller.
You say that you do internal medicine. My husband has Crohn.
Crohn's disease?
Yes.
Okay, yes, that is a disease that involves inflammation of the digestive tract, and there's a lot that I can do as a naturopath to help calm down the inflammation. And I'd be happy to.
Do you take Access?
Unfortunately, Access doesn't take me, meaning as a naturopathic medical doctor, Access does not recognize my degree, so they will not pay me to do anything. unfortunately.
I see.
So
I'd have to pay out of pocket. And where are you located at?
we are next to the American Legion on the the Arizona 260, headed towards Star Valley, just before you get to Misfits Cafe.
Okay, thank you.
You're
You know
welcome.
what I might advise is that set up a time for a free evaluation and find out what the cost might be. And I'll tell you, if it makes you feel better and it makes you be able to cope with the situation, it's worth it no matter what.
All right, thank you.
Thank
Okay,
you.
and
All
the
right.
number to call us?
928-474-7409.
Yes, call and leave a message if you don't get a live person picking up, and we'll be sure to get back with you. We still have 2 topics to cover, so I'm going to make an executive decision and punt on additional topics for tonight.
I do want to mention one thing here, too, and that is that, Dr. Weyrich, you are, because of the fact that Dr. Gear is rehabilitating, you are doing some adjustments now,
Yes.
and you are, of course, a specialist in anti-aging medicine.
Yes.
And if you have, when we were talking about the allergens, and if you're having a lot of problems like this, you can, arrange for the test to find out. I know I took the test, and I was really surprised at some of the things that I was not necessarily allergic to, but I was creating allergens, which were making me tired,
Yes.
crabby, and, just not feeling good.
Yes.
And I've tried to reintroduce some of those foods, like tomatoes is one of them. I love tomatoes, and but when I eat them, I don't feel good.
Okay, well, let me remind all our listeners that I offer a free 15-minute or sometimes more consultation on whatever your concern is. If you have x-rays and you have back pain or whatever, bring it in and make an appointment and bring those in, and I'll talk to you about it. If you have internal medicine issues, you have blood work that doesn't look quite right, bring it in. I'll be happy to talk with you. And
Yeah, you're very good, too, at second opinions.
Yes.
I know I have heard several things and had some tests done, and doctor told me one thing, and I thought, oh, man, I don't want to try that medicine. It's a real high risk. And, is there any other way to go? And I've run some of that and shown you the test, and you are very good at interpreting what they are. Okay, we'll see you next Tuesday night, 5 o'clock, right here, same time, same station.
You've been listening to Doctor's House Call, aired every Tuesday afternoon from 5 till 6 p.m. To call Dr. Gear after the show during his business hours at Payson Health and Wellness Center, 801 East Highway 260, call 474-7409 or go to his website, drbobgear.com. That number again, 474-7409.